Hi everybody, this is part 2 of the phosphatidylcholine video, or part 2 of the phosphatidylcholine discussion. Please excuse my voice, I lost my voice a couple of days ago. It's coming back online now, so hence the raspiness. So in part 1 I went over just a general overview of what is phosphatidylcholine and why might it be something that we care about. So what is the clinical utility or clinical relevance of using phosphatidylcholine? So what I found in my experience is that for dealing with liver-related issues, whether it's, shoot, maybe I said this in the first video, okay, just in case I didn't, just quickly gloss over, if there's liver dysfunction happening, or rather if there's liver disease happening, I should say, so if there's hepatitis, if there's non-alcoholic fatty liver disease, if there is just elevated liver enzymes for some unknown reason, if there's liver cirrhosis, phosphatidylcholine can be really, really helpful to help facilitate that liver cell / hepatocyte regeneration. So that's the biggest role that I've seen phosphatidylcholine play for my patients. Now, I recently interviewed Dr. Laurent Tessier, brilliant naturopathic doctor. She is well known for treating mold illness, but she treats patients with complex chronic illness in general. So you can't really not treat complex chronic illness if you're a mold specialist, because it's such a common feature of so many patients with complex chronic illness. So I recently interviewed her for my upcoming podcast, and she was talking about how in her practice, while she, and I'm paraphrasing and I certainly don't speak for her, but the take-home message from our conversation that I got was that when she puts patients on phosphatidylcholine, she doesn't necessarily see significant clinical changes from the phosphatidylcholine itself. However, she finds that when patients have that phosphatidylcholine in place, especially the very sensitive patients, they're able to tolerate other treatments better. And that does make a lot of sense, excuse me, given the importance of phosphatidylcholine and helping to being so important for the stabilization and structure of our cell membranes, mitochondrial membranes, things like that. I've, in my experience, I haven't really seen a whole lot of clinical change in that patients will say, oh, my brain fog's better, my energy's better, my joint pain's better, my this or that's better from phosphatidylcholine as a supplement. However, having recently chatted with Dr. Tessier, I'm thinking about maybe taking another run at the phosphatidylcholine. I do include it in some of my protocols. I do use it when I'm working with patients who have gallstones, or if I need some extra support to help their livers to produce more bile or kind of flush more bile from their systems. So the phosphatidylcholine does have a place. I just find that it's a little bit hit and miss in terms of actually seeing clinical results from using it. But I am going to look at it through a new lens, and I may kind of work with this with some of my patients who are on the more sensitive end of the spectrum, and see if I find that the phosphatidylcholine is kind of an enabling supplement that helps other things to work better. When it comes to intravenous phosphatidylcholine, we've done lots and lots of that. Again, everything that I said about oral phosphatidylcholine, I say is pretty much true of IV phosphatidylcholine. It's just a lot stronger. I've had some miraculous changes with patients who had severe liver disease with bringing in IV phosphatidylcholine. I think it literally saved one of my patients' lives many years ago. So I think it's a very, very useful tool to have on board in terms of really moving the needle in a really meaningful way for patients with complex chronic illness. It's relatively hit and miss, and it seems to need to be combined with other therapies like alpha-lipoic acid or glutathione. And quite frankly, I just find that for a lot of patients, I get better bang for their buck doing things like intravenous ozone therapy or intravenous photobiomodulation or high-dose intravenous nutrients or different things like that. So it is a therapy I've used quite a bit. Just don't see it making a huge clinical impact very often. So I tend to kind of reserve it for certain cases. Not something that I really recommend en masse a whole lot. Again, bearing in mind what Dr. Tessier was saying, it might be something that I kind of look at again with fresh eyes, and it might be something worth considering moving forward with again in the future. So thank you to the person who asked this question about the phosphatidylcholine. I love phosphatidylcholine. It's an amazing substance, just not the most exciting supplement clinically, but maybe again I haven't been using it in the right way. We'll see. If anyone listening is using phosphatidylcholine, if you found that it's been helpful or not helpful, or someone where it's been helpful, please post in the comment section below. I'd love to hear about that. Getting clinical feedback from patients is my patients or patients who are out there that are not my patients, i.e. those of you listening. I'm sure everybody's maybe a patient of someone, but anyways, I'd love to hear feedback to learn more about it through other folks, because it's really useful for me, and I can translate or pass on those benefits of extra knowledge from me to my patients. So I'll leave it there for now. If you have any questions outstanding about this topic or anything else, please post in the comment section below, and I will leave it there for now.